Let's talk about a patient whom I'd been asked to consult, a 26-year-old lady who had been trying for 1.5 years. The sperm count was normal, with normal motility and count, and morphology varied between 1 and 3%. Sperm DNA fragmentation showed that the DNA fragmentation at 24% was slightly at the upper side of normal and considered to be good to fair. Couple are very keen on IUI, and considering the age of the patient, IUI seemed to be reasonable. Now let's look at the evidence. When we looked at low morphology, 1 to 3%, this does not exclude IUI success rate, and multiple studies did indicate that there is no clinically significant difference in pregnancy rates between men with normal morphology and with abnormal morphology between 3 and 4%. What was important was a total motile sperm count and female age, and those two are key indicators. A meta-analysis of 1,018 IUI cycles showed a similar pregnancy rates of 14.2% versus 12.1% between morphology thresholds of more than 4% and less than or equal to 4%. In 2024, a study of 1,059 IUI cycles reported a clinical pregnancy rate of 16% with normal morphology and 13% with mild or moderate morphological abnormalities, and 10% with morphology of around 2%. Now, combined factors such as low morphology becomes problematic when it's coupled with low motility and total motile sperm count is less, and it's then less than 10 million, where pregnancy rates are significantly low. Let's now look at sperm DNA fragmentation of 24%. It's borderline, and while some studies associate DNA fragmentation of 20 to 30 with reduced IUI success rates, the impact at 24 is less certain. DNA fragmentation index sometimes correlates with lower chance of pregnancy, but that again, female age tends to matter. In 2022, a study found no significant difference in clinical outcomes when DNA fragmentation rate was less than 30% or more than 30%. Again, what is important? It's total motile sperm counts and female age. So in this case, what would be my recommendation? So the tubes are open, proceed with IUI, look at the total motile sperm count, and give IUI a try. If the motile sperm count is good, then let them have 3 treatments of IUI, and the success rate will be around 25 to 30% in 3 cycles.